Bring the action.
Go.
Frontalis originates from the cranioaponeurosis. The insertion is the skin of the eyebrows. You can raise it. The orbicularis oculi originates from the frontal bone and the maxilla. The insertion point is the tissue around your eyes, allows blinking and closing the eyes.
The corrugator supercilli originates in the frontal bone and the supraorbital region. The insertion point is the skin tissue of the eyebrows. The action causes vertical wrinkles in the glabella and horizontal wrinkles of the nose.
Let it all out and scream and shout.
The levator palpebrae superioris originates from the inferior aspect of the lesser wing of the spinal cord. The insertion point is the superior tarsal plate and skin of the upper eyelid, and this elevates and retracts the upper eyelid.
And scream and shout and let it out. We saying oh, we oh, we oh, we oh.
Angie, Anna.
Gabby. Next is the orbicularis oris. The origin is the mandible and the maxilla, and the insertion point is the skin and the muscle around the mouth. The action is that it closes and protrudes the lips.
Next is the zygomaticus major, which is right here. The origin is the zygomatic
The
bone.
action.
The insertion is the skin and corner of the lips, and the action is smile.
Going fast, we ain't going slow. No, no.
The next is the zygomaticus minor. The origin is the zygomatic bone. The insertion is the upper lip, and the action is assisting smiling.
You know what we talking about.
The next muscle is the levator labii superioris. The origin is the maxilla, and the insertion point is the upper lip, ala of the nose and upper lip.
Bring the action.
Its function is to elevate the upper lip.
All muscles up.
We're gonna turn it up.
The next muscle is the depressor labii inferioris. The origin is the mandible. The insertion is the lower lip, and the action causes depression of the lower lip. The next muscle is the depressor anguli oris. The origin is the mandible. The insertion is the angle of the mouth, and the action is frowning.
Scream and shout and let it all out. And scream and shout and let it out. We saying oh, we oh, we oh, we oh. We saying oh, we oh, we oh, we oh. I wanna scream and shout and let it all out. And scream and shout and let it out. We saying oh, we oh, we oh.
Angie, Anna.
The next muscle is the buccinate. The origin is the posterior alveolar margin of the maxilla and mandible. The insertion is the orbicularis oris and the angle of the mouth. The action is to compress the cheeks to hold food between the cheeks while eating.
Next is the risorius. The origin is the fascia superficial to masseter muscle. The insertion point is the angle of the mouth. Its action is stretching, retracting, widening to produce grinding or smiting.
The next muscle is the mentalis. Its origin is the mandible, and its point of insertion is the skin of the chin. Its function is to express doubt, raising chin and protruding lower lip. The next muscle is the platysma. Its origin is the connective tissue covering the superior chest muscle. Its point of insertion is the tissue around the mouth, and its function is to tense the skin of the neck as in shape. The next muscle is the masseter. Its origin is the temporal bone, and its insertion point is the mandible. Its function is to close the jaw by elevating the mandible.
The next muscle is the trapezius. The origin is the occipital bone and all cervical and thoracic vertebrae. The insertion is the scapular spine and clavicle. The action raises, retracts, and rotates the scapula. The next muscle is the sternocleidomastoid. The origin is the sternum and clavicle. The insertion is the temporal bone. And the action flexes neck laterally and rotates the head. The next muscle is the temporalis. The origin is the temporal bone.
Bring the
The
action.
insertion is the mandible. The action closes the jaw.
It's anatomy, kids.